We're going to welcome back Alison Vella, who's going to be joined by 4 panellists for this discussion. And it's going to be exploring the relationship between the role of assessment services in identifying people who could benefit from reablement and the role of the service providers. So we've got Shay Egan, who's the Acting CEO and Operations Manager for Aspire for Life. Karina Dutlow, the CEO of Australian Filipino Community Services. Nicole Donoghue, Head of Allied Health and Development of Baptist Care at Home. And finally, Andrew Lambourne, who's an aged care assessor and workplace trainer with Aspire for Life. Welcome to you all.
Thank you, Paul.
Thanks, Paul. Really looking forward to this conversation this afternoon. We're sort of going back to my roots here a little bit. I was a 7-year aged care assessor, or RAS assessor back then, with Aspire for Life. And in recent times, I've come to know Nicole and Karina as well from their service provision. So thank you all for joining us this afternoon. As we said, Shay has had over 4 years in the role of operations manager with Aspire for Life. So overseeing the strategic planning and operational management of the organisation, including the single assessment service. Karina is the CEO of AFCS, and she's been instrumental over the last 7 years in expanding the resources and service access for ageing Filipinos across Victoria. Nicole is an occupational therapist and serves as the Head of Allied Health and Development at Baptist Care in New South Wales. And Andrew is an enrolled nurse, has several roles as an aged care assessor, workplace trainer, previously worked in veterans home care in the assessment team there as well. So we've got a lot of experience here with this group. So I'd just like to say we know that it's been a challenging time over the last few months for both assessment organisations and for the service providers, not only adapting to the changes you've recently had to make, but also now setting up for the next phase as well. So thank you all for agreeing to participate in this conversation. And I'm sure we're going to have some great insights into both work streams and the where to from here, pretty much. So if I can start with, are there any key changes or learnings from this recent period that anyone would like to share with the audience about sort of what you've been experiencing, what have been perhaps those biggest challenges or barriers, sort of, how are you feeling moving into the rest of 2025? Might start with you, Shay.
Yeah, thanks, Ali. Well, look, at Aspire for Life, one of our biggest learnings during this period has been the importance of adaptability and communications. I guess generally in any type of change management, and this is really what we're undertaking with this new single assessment system, they're the 2 key themes that ensure the success of the transition. So the volume and I guess the pace of information coming from the department, while intended to support the transition, has meant that we've had to develop new internal systems, new processes, and implement change rapidly across the whole workforce, but also within our own relationships within community. So there's certainly been some fatigue in that, but there's also a bit of excitement. I think, like, for us as an organisation, this is something that we've been really preparing for a number of years now. And I guess, like, the excitement is that we're seeing this transition happen a little bit earlier than expected for our establishment in single assessment, but now looking forward to, I guess, the support at home program. So it's created opportunities for us, and I guess fresh thinking. We've been able to really challenge, I guess, how we've operated in the past, and those relationships, and how we've engaged with collaboration with the other assessment organisations. So that's been good.
Yeah. You mentioned 2 words that have been tied together a lot in the last couple of years, change and fatigue. How's things been going for you, Nicole?
Yeah, I mean, I suppose similar issues, and certainly over the next few months, the next 3 to 6 months are going to be crucial for us in terms of making sure that our staff have all the necessary information to make sure that they're able to comply with the requirements. One of the challenges, as everyone would know, is just in relation to staffing of or for providers, and making sure that our staff, and they're all increasing in volume day by day, are appropriately onboarded to ensure that they actually get the information they need from the outset. So Reablement wellness principles and information around that is presented again at that very early stage. There's so much to provide them with information about, but that needs to be a key priority for us, and it's certainly something we've done at Baptist Care to prioritise that.
Excellent. What about yourself, Karina?
It has been a challenge in trying to keep our clients informed of all this change, and when the department is updating us and what's happening with assessment teams and things like that. I think, just trying to inform them as much as we can and reassure them, even with the limited information. For us, it has been very insightful to learn what is stressing out and causing anxiety among our clients and their families, as well as their carers, especially if we're moving towards now a lot more changes come July. So we're really always trying to take the positive as much as we try. Take the positive from it and try to apply the learnings from that.
Yeah. And what about yourself, Andrew?
I think we've had some great opportunities to reinvent some pieces that we actually delivered during our training, which has been wonderful. The clients when we're out in the field seem to be quite excited about the changes. They can definitely see that there's a lot of positives moving forward as well. And I've found that they've actually been really patient with the changes. I think there has been a lot of information out there. A lot of them have followed the reforms. For us, from a training perspective, we've had wonderful contact within the department. They've been freely available to help us with questions and queries whenever we've needed them, and that's helped us develop our training. So for us, it's pivoting daily. However, it's in a positive way.
Yeah, and that talks to those relationships, doesn't it? So, the relationship between yourself as bringing on board new assessors, etc., with the department, they're fully supportive and sort of in contact with you and providing resources and everything, which is great. Yeah. So how do you feel the relationships are at the moment between assessment organisations and service providers? I know from myself, sort of back in my days doing assessments, I loved contacting service providers whenever I got the chance, just to, check what's happening with this, or, can I just let you know I'm going to send this referral through? Loved having sort of that, knowing who I was sending the referrals to and having that conversation. But what do you think will assist in rebuilding those relationships or sustaining those relationships from this point onwards? I might start with yourself, Nicole.
Yeah, sure. Yeah, I'll speak from a provider space. I think for us, it's sort of, an open door policy in terms of wishing and intending, being intentional, I suppose, in terms of collaborating with our assessment partners. Particularly, I think, just around the newly contracted assessment agencies as well. We know that establishing relationships, as you've alluded to, Alison, is key in terms of supporting clients to implement, the wellness and reablement strategies that we need to. So, and also making sure that we're on the same page in relation to that goal setting as well. We're so dependent on assessment agencies and information they provide us, particularly within the support plan itself, to give us an indication of what the priorities are for the client. And we know at times it's not possible to attend to all those priorities in the beginning, but even getting a sense from our assessment partners as to what that priority is as well, and that we've they've started having those conversations from the beginning with the client. So we're not the first person going in to actually talk about wellness and reablement at times. I think in the past, hopefully, Amy, our motivations in relation to not providing as much service as potentially clients would like may have been misconstrued by families particularly, but that the assessment agencies already had those conversations about what we're really trying to achieve and to support independence at home.
Yeah. Karina, your thoughts on that?
Yes, I mean, we can't deny, it's been a lot of change, and it has broken down the built relationships with our local assessors, our local RAS, but in saying that, we are working with new assessors to build our working relationship and be known to assessors, especially in the cold specialisation space. So we are building. It will take time, but we'll get there. We have to get there. So, it's just at the building stage at the moment. Also wanted to mention that our local sector support development team late last year delivered or provided an opportunity for us to meet the assessor organisations, including Aspire for Life is on here, and for us, for them to introduce themselves to us, share a little bit about the organisation. I did find that really, really helpful, and also learning about what regions they're covering. It was great to put a face to the organisation, but most of the organisations, the assessor organisations, if not all, were senior management. So it would be great to have the opportunities to connect with the actual assessors and build on those relationships between us providers and assessors.
Yeah.
We can, thanks, Ali. We echo the same sentiment. We've certainly felt those challenges, particularly during the early phases of the transition, when information was moving very quickly and expectations were kind of evolving really rapidly, and our big focus was just trying to set up the workforce and especially in new areas we obtained. So it's as Nicole and Karina said, it is a great opportunity, though, to strengthen how we work together across the sector. And as we said before, really challenge those previous systems and processes. So we're definitely moving in the right direction to reinvest in relationship building and reconnect in those regions where we've had those interagency meetings or sector support groups and community of practices. And they're usually, for us, definitely attended by our senior leaders and service area managers and assessors. So we know those collaborative forums, that's where we rebuild that trust, we share knowledge, we can kind of develop those consistent approaches that benefit clients. And it's in our view that the best outcomes are achieved when assessment organisations and providers are working in partnership. I know just specifically, I had a meeting yesterday with a community urgent care service where the focus was reducing admissions into hospital. And one quick conversation, and we were able to develop a really engaging pipeline and pathway for ad hoc services and urgent services, where the waiting for going through the My Aged Care system and generating a support plan review that then goes into potentially a reassessment, it would take too much time. So that's all just through those collaborative engagements and kind of localized meetings.
That was going to be my next question. Sort of, what sort of opportunities do you all find exist out there that you're aware of that help to facilitate those sorts of relationships, like those interagency, etc.? Are there other really big ones that you'd like to sort of promote or plug or, ensure that other people get involved in?
Community practice, interagency, care finders, local councils, even linking in with general practitioners. They're all different avenues where we're supporting the same clientele.
Yeah. definitely. Yeah.
I would just share, and this was, the feedback I received from my team was that, for example, in that meet and greet, virtual meet and greet with assessor organisations, a few of us did feel like the onus was on us providers to reach out to the assessors, and so it would be great to see. Echoing what Shay was saying was, assessors reaching out to us. We're all publicly listed on the portal, and, more specifically to specialization providers. Obviously, if clients are looking for, very specific services or, in our realm of cold specialization, there's a number of providers that are providing that specialization with our language in particular. So, really targeting us, I would say, but, across other specializations as well, just actively reaching out to us.
And I might just add to that. Sorry, Andrew.
Yep.
I think particularly when providers are involved with the clients, so in reassessment situations as well, to get some further information. Obviously, we try and be as comprehensive as possible in relation to our support plan reviews, but sometimes, there may be some key information that you think, actually, as assessors, this isn't quite adding up. But to actually have a conversation with us, because we're in there, often have been in there for years as well, and so to actually give that clarity and I suppose, again, support you to align with what you're seeing versus what we're requesting as well. We often, if an assessor walks out the door and possibly hasn't provided the client with the supports that potentially we think they need, we feel like it's a missed opportunity as well. So I think having those conversations at that point would be fantastic.
And we definitely promote that within Aspire, which is great. It is to reach out to those service providers, especially to if they're out on assessments and they do even come past you, call in, say hello, see what's offered. They definitely we heavily promote, obviously everything's client-centered. And I think too, sometimes it's reaching out to the community so the community knows who you are and what you do, because we ask the clients, is there anyone specific you would like us to send your plan to? So it's also, and with clients, sometimes we are in the background, we're all working away, and clients, because we're representing, obviously, we're all different parts of the sector. But when we do get those opportunities for that community engagement, it is where the clients become aware of who we actually are as organisations and people.
Exactly. Yeah, so true. How important is the information, and specifically, I guess, the goals, you've sort of touched on it before, Nicole, but that the information that you see in the support plan and the goals, and, how important is that information then to help you as a service provider create a reablement focused care plan? So, moving through that transition.
Yeah, look, it's critical for us, I suppose. Well, one of the strategies we always recommend to our care managers, that a support plan is the key reference document before they make any contact with the client. So they're really getting a very good background in relation to the client and their needs, social environment, home environment, all those aspects that make a difference. So it's a key point for us, a key reference document. One of the things we also do, or have recently introduced at Baptist Care, is our intake meetings where we speak about each client that has come through to us as well. So we're using the support plan, we're using the information from the client that the care manager has been able to ascertain as well, and really discuss what is it that will be valuable for this client, a preventative approach as well as what we need to do right here and now. But again, it's crucial for us to then develop that plan that we're considering all aspects of the client's life and the potential changes that may be just down the road as well.
Yeah. Anyone else have any thoughts on that one?
Yes, if I could jump in.
Absolutely.
Just continuing on what Nicole has shared, to provide context, we we work with our clients, preparing them for their aged care service journey, if you will, through the My Aged Care registration, assessment, and so on, and to the service delivery point. For our organisation, we encourage self-assessments where we engage our clients and their families to self-identify the services and needs that they have, because then there's more organic conversation around their needs and what's going on at home and things like that. Feedback from our clients with that type of approach with, self-assessing has been quite positive. Participants have shared that they found our conversations yet, confronting, but yet very empowering and dignified. And so, we're working to break down those barriers with a, closer reablement lens. We are closely working with our clients, equipping them with the and their families with the language and the more specific things that they would like to voice for services and goals that they have for the older person, so that they can be connected to the community, supported, and essentially live independently as possible. A key focus that we are really doubling down on at the moment is encouraging older Filipinos, along with their families, to voice their cultural and language needs. We don't see a lot of it on support plans. Not saying that they don't ever appear, but we are supporting the importance and prioritization of this on their support plans because we see how important it is. We sometimes see the support plan that is published on My Aged Care and then our care plan that we have, in the organisation. And our care plan is a lot more comprehensive and is capturing those cultural and language needs and the importance there. But why is it being missed on the support plan? Are we just using more concise basic information when it's assessment time and things like that, and our clients and their families not relaying the importance of the language and cultural needs as part of their service delivery and their goals? So we're really working on that at the moment, just to really foster that independence and the confidence of our older people. I would just say that, if assessors, which I'm sure they will and are, with, increased recognition and that prioritization of these needs, within their reablement goals and services, it will actually provide an opportunity for us providers and assessors to work hand in hand in breaking down barriers and essentially enhancing the services. So, I do see this, this new aged care system is an exciting opportunity to grow that, especially in my community. Thanks.
Any thoughts, Andrew or Shay, on that?
No, yeah, we agree. Like it is, I guess, generally like for us when we're delivering a support plan, it is utilizing the integrated assessment tool fairly prescriptive because we want to ensure uncare needs are met, and especially now delivering comprehensive assessments that that care journey is clinically appropriate. So there's some, I guess, some learnings for us around how we expand that even further, and moving away from the prescribed tool and to as Karina was saying, like reflecting some of those cultural and linguistic preferences. And we often find that when we match the assessor to the person correctly, so we can provide those culturally intelligent assessments. And that's probably key for us as well, ensuring that the right assessor is matched to the right client.
I think on that too, it's we do know that not every client fits into the box on the system. So it's having those conversations with the clients, the families, and obviously with the cultural clients we're using, often we're using the interpreting services. So it's also trying to work with those services as well to make sure that the questions or the conversations we're trying to have with the clients are definitely translated in the right way and back to us as well, so as that we can try and document that properly on the support plan so they can actually get the correct services that they need.
Yeah, it can be really challenging, can't it? For sure. Okay. So the process of referring clients for a review at some point is really important to obviously both organisation types here. What are the key pieces of information that need to be considered in that area? So we might start with the provider perspective, Karina and Nicole. What are sort of like the key pieces of information that need to be captured when a review is needed?
Okay. Well, as I've mentioned, we are supporting them through those assessment processes and reviews as well. And likewise, we are still supporting them to clearly voice, the new changes, the new situation, and link those to services, because of course we need to justify why they need, more services or increase this or that. Clients in majority are wanting our staff to be present during a review, whether it's via phone or in person, just to provide that additional support if needed. Just for the senior, if let's say it's just them, they have someone to lean on, in particular for language clarification. Maybe the jargon just went right past them, and they need a bit of breaking down of the information, because it can be confronting. And we've seen a number of clients just cancel last minute because their anxiety levels were through the roof. They just couldn't handle the pressure and everything like that. Like, this is my one shot kind of thing, to get increased services. So, just working with them through that. I think just, with the review process, assessors need to understand and recognize and, in fact, embrace a provider's contributions and support. As Nicole was mentioning, we've been journeying with these clients for some from the moment that they turned 65 and even before then, and, starting this aged care journey with them, their aged care service journey. So I think it is an act of reablement to support their confidence and self-advocacy for services that we are providing, and work hand in hand and with assessors and our service providers, and vice versa, that communication and during assessments as well. That's my take on that.
Yeah, I think for me, for us to be very clear as to what precipitated the need for the support plan review. So at times it may be an annual review, though that's less likely, to be honest. It's more that there's been a change in circumstance, so potentially hospitalisation, accident, illness, change in social situation as well, and us, detailing that. Also, I think detailing what we think would be helpful for this particular client. The other thing I would say as well, that I don't think it just relies on the support plan review information, but that we're feeding into My Aged Care regularly as well. So we're demonstrating that, in fact, that this is an ongoing review process, and that we're quite clear in terms of what service provision is being delivered as well. At times, I think there is a risk that we will do that at the beginning, but in fact that's not sort of seen as a living document. But certainly from my organisation's perspective, the recommendation is, or requirement is, that we are feeding into the My Aged Care record for the client as well, and that remains current.
Yeah, I echo that. That's a real positive piece in determining what are the requirements, especially from the assessment perspective. So we know for reviews, but they need to be well documented, clearly justified and timely for them to be a great experience for the client. So ensuring that there's some relevant context in those changes in circumstances highlights our ability to identify the priority level for the client, so we can action those urgent referrals as quickly as possible.
Yeah, definitely. What do you all think are some really good best practice models at the moment that are really important for, again, both organisation types to ensure that reablement is at the forefront of the client journey?
I'll go first with this one, Ali. Training and storytelling, they're probably the best drivers. So when we're undertaking, I guess, any type of reporting requirement, but also going in through staff induction and professional development, utilizing those real client stories and providing small wins or life-changing outcomes really inspire and remind our teams the impact that they're having and the benefit of reablement outcomes. Definitely that's something that we could share across both service providers and the assessment organisations, because it kind of reinforces that value of a united approach. And when for everyone in this group, we're always looking at the problems and solutions for those problems. So it's always good reflection to look back around, well, what has worked and what has been a benefit. And they may only be a minor blip for us in the context of the number of clients that we're servicing, but we know that it's a significant change for that client.
Yeah, they always say in life as well, celebrate the wins. And every time a client does, achieve their goal, and they often have that sense of, it's just never too late. It's good. It gives them that feeling that they are still achieving things in life. And even with the help of services, reablement doesn't mean that they need to cease their services. It means they can work and build alongside the services. The aim is stay independent and stay at home. And if that means that they receive that support, that's awesome.
From a provider perspective, I think it's the investment in education that I spoke about earlier, particularly for our care staff as well. So they're the eyes and ears. They're in much more regularly than our care managers. One of the things that we've done is educate our care workers just in relation to common health conditions that older people may be experiencing and the indicators where potentially that's not being well managed, and making sure or encouraging them to report on those things again so we can intervene early and potentially, minimise the risks of something more serious happening. So the care staff piece is, a massive concern for us, investment.
For us, we've always upheld the doing it with them, not for them. I think that's a big one, and continuing, that message to our clients and their families as well. We're also looking to plan more long-term with families, for example, engaging families and carers to be involved from the beginning of services and support so that the services and support in general for that person is more sustainable and not solely reliant on formal aged care services. So we're really going beyond just the formal services they receive from the government, but making it a whole family approach to supporting the older person in the family. We have been working on improving our feedback mechanisms to evaluate and review that, throughout their service journey and their service delivery, reablement is embedded. And with that comes the feedback and success stories from our care workers or our frontline staff to actually capture and be more intentional in capturing reablement, because they're seeing it, in front of them. And it is also that identification as well. Like, oh yeah, that actually counts as in, reablement. That even though it's something small, all of those small things, really support a person. So we're also working on that.
They're all wins.
Yeah, I love that. And looking again, sort of, at your feedback mechanisms, how can you do that really well? That just is absolutely best practice right there. That is fantastic, which is great. You've sort of all touched on it a little bit. My next question was going to be, but I think we've already covered it. It's sort of, how has your information sharing and training with the teams changed over the last 6 to 12 months? So I'm not going to Andrew first because that is your role.
We have added a lot. So as the system has changed, we're now, as everyone is, a single assessment system. So we're now training non-clinical home support assessors. We're training clinical staff members for comprehensive assessments. What has been really interesting with our training is that we train them all together. So our home support assessors have an understanding of what happens for clinical clients. That is so important now. It's not just a fixed idea on one road that we go down. They understand that where a client might start with home support assessment and they might be good with that for a little while, but as their needs change, they also know now that we can actually get the client's assistance in a more timely manner by actually being single assessment agency and being able to send someone in for a clinical assessment.
Which was the point of the whole system creation, wasn't it? Yeah.
It's been great. But it's having that understanding. So I think it's around, it's kind of like when we talk about relationships between us and service providers, we were always missing that relationship between home support assessments and clinical assessments. That gap has now been bridged, and within that, our training has all changed dramatically. But we still focus on the client's strengths. However, as we know with clinical assessments, we now need to go down the track to make sure for the service providers and for the clients that we're recommending the right level of service. We now know that we do, in that instance, for that type of assessment, we heavily need to look at their weaknesses as well. So, and in that, obviously, we're looking at opportunities for around reablement and how the client in that situation can work alongside their service provider to make sure that they are staying healthy and independent in their home.
Yep. Fabulous. Would any of you say that you've got like a reablement champion or somebody sort of within your organisation that sort of, really drives the cause, is really like the go-to person?
Well, I would say, Alison, we had a very strong component last year, which was yourself. But with the assessment workforce, yes, we do. And it's like having a dedicated champion or even a network of champions makes a significant difference in driving that focus forward. It provides that peer training and support, and we've seen how firsthand how powerful it is when not only individuals understand reablement principles, but also a team understands it, so they can start advocating and educating and embedding it into daily practice. And we do see, especially as we deliver aged care assessment services across specific regions, you can definitely pick that out because we've got a governing KPI and we're our strong team. So for us, it's definitely about going, well, how do we support those other teams? How can we develop those champions to really promote it?
From our perspective, we have recruited a number of allied health staff, and one of those roles we call a health and well-living consultant. And so we have one of those positions in each of our sites now. And certainly they, I think, encourage, empower other staff to really be thinking about the strategies that can be used. So it's not just relying on allied health, and I don't want to ever suggest that, but it's really educating, encouraging, engaging other staff that they have a role to play as well. And as Karina said, the small things at times can make a world of difference, and, supporting people with understanding that. Yeah.
We have a champion, our service development officer. She's excellent. She's been around since before reablement was a proper word that doesn't have a red underline under it. And she'd always, even till now in meetings, just pull up and say, well, how could we do this so that empowers the client and, it has the reablement focus. All the time she pulls it up in our meetings, but it always keeps our team on their toes to always be thinking from a reablement lens. Just in related to training, we're training our staff at the moment to have more constructive conversations and more focused on clients' strengths and goals to living essentially their best life. So when we talk to them, we don't always say, "What are your goals?" Yeah. It's just what does it mean to live your best life? Yeah. So and from there, from identifying we're essentially identifying and extracting the service needs from those conversations. And then, as well as reablement opportunities, service improvements, feedback, things like that. So we're going about it less sort of pen to paper. What are your goals?
Yeah. Yep.
More casual.
Great
conversation.
approach. All good. Thank you so much, guys. Paul, were there any particular questions or anything that popped up for
There
this
were
group?
there were a couple of questions that came up for the group. One was from Tamara asking, do some assessor care plans stand out more than others? And what about it is that? Is it that they identify the client's strengths particularly well? Might be a question for Nicole or Karina to have a crack at.
Yeah, I mean, I think it's probably the things that we've spoken about already, in that there's a very clear information provided in relation to the key concerns for the client, the context in which they're living, and I think also their commitment in terms of reablement and wellness. So we get a real sense of that early. That's not to say we don't actually attempt to engage them on that level, but I suppose it just gives us a bit of insight as to how hard we might need to work and try and bring them over to commit to that. So, yeah, I think it's just the comprehensiveness of information and the context in which the client is operating.
I think also adding to Nicole is the attitudes and perhaps past experiences that perhaps we will need to tackle. If they've had bad experiences or family members have had bad experiences engaging services, assessment, we also have to take that on board. It could also be anxieties and trust with government because, essentially it is a government department that we've got to tackle. So there's a lot of prep work before we can get an assessor in front of them or on the phone. We find that sometimes the phone is more intimidating for a client than a face-to-face, or sometimes a face-to-face in their home standing across them is more intimidating depending on the client. So it's really taking it at the pace and how that individual person and their family or carers are at, and building on that.
Thanks. The other question was one for Shay or Andrew to address, which is really around what's the impact of the delays in getting assessments. There's obviously different lengths delays for different types of home care package level, and also just a general backlog of CHSP level information. And of course, with the change to the single assessment agencies on top of that, you've got a system that's jabbing up in some places. What impact is that having?
Yeah, it's quite significant, Paul. I know, like, from our perspective, we've been working with a wait list from exiting providers. So trying to determine urgency is a key process. And for us, we've got this philosophy around active assessment, and the best way for an active assessment is face-to-face. But unfortunately, sometimes you've got to mitigate some of that risk when you see clients who haven't been assessed for 12 months or longer. We also understand that even when undertaking the triage process, by the time you hang up that call, a potential client's needs have changed.
Yeah.
So for us, it's definitely trying to identify which clients need to be seen earlier and which ones need to be seen face-to-face. And for us, underneath this new piece, and we're an existing assessment workforce. So we don't have the significant recruitment challenges of some of the newer providers. So for us, we were lucky that we were involved in a limited tender in Victoria last year. So we were able to recruit and transition staff from Victoria early, way before the implementation of single assessment.
Yeah.
So yeah, it's significant, and I think it's for all parties. Like, one of the things that we've identified is trying to work in with other assessment organisations, providing that collaborative approach and trying to identify where there is capacity and availability, and trying to address where it's needed most.
Yep. Okay. Thank you. I think, Alison, that concluded the questions I had.
Thank you.
Thank you, Alison.
Thank you.
Thanks. Bye.
So, Alison, I don't know whether you can stay on, whether some of the others can join us back on screen as well. One big question which came up in the middle of the day, which we didn't directly address during the presentations, is this question of the capacity of older people to want to change, and the workload on what are a workforce that is, experiencing its own pressures of time. And the question was framed, and there was a bit of debate going on in the chat around, do we have enough time, particularly through CHSP, where you're pretty time limited on the amount of contact you have with the client? Do we really have time to do wellness and reablement properly? What do you think, Alison?
It's an interesting point, isn't it? And like yourself, I've sort of been to a lot of other online webinars, conferences and things over the last few weeks in particular around the CHSP. And it's a very strong message that comes across around that time factor. And it is absolutely a valid point. It's sort of the same from assessment perspective, and speaking about that, because that was my experience before coming to KeepAble. Assessors sort of feeling I don't have time to do the follow-up, so I can't tick that box for reablement in the support plan initially, even though it probably is, because it's the time for the follow-up. The whole sector, yes, is under stress at the moment, and we've taken that on board, and that's where we've sort of tried to create as many resources, I guess, as we can that does try to simplify things down as much as possible. I'm not sure if Kirsten is still online this afternoon and wants to weigh in on this one at all as well. But yeah, it is very much an issue. And if we've got, if we can sort of, support with training materials and things like that. But yeah, it is a big question, isn't it, Paul, for the department and the sector on, do they have the time? Do they have the funding for that time as well?
Yes, that's right. I'll come to you in a second, Kirsten. Lisa's just put in the chat. It's an interesting question, Paul, but I think we can turn it around and say, can we afford not to do it, particularly as we're committing to a rights-based aged care system where the older person is at the centre? And that is absolutely true as well. Yes. Kirsten, what's your thoughts on this?
Yeah, thanks, Alison and Paul. I apologise, my camera's given up the ghost. It's had enough of me today. But I think we've deliberately today just used the word reablement repeatedly because wellness and reablement is a mouthful. So when we're thinking about time, there's the one element of the fact that we can actually request a reablement period, which then sort of opens you up for that opportunity to have the resourcing and everything to put into a much more goal-directed focus for that sort of 6 to 12 weeks, whatever it might be, which is different to, wellness, which is that overall approach to how we work with people every day. And I think that's where we've, really tried to come back to this thing about those repeated opportunities that are really small but mean so much. And, if I went back to my favorite example about the shopping bags, don't load up the shopping bags too much, but let your client pull those shopping bags out of the cart and put them into the back of the car. You've just done reablement. Or you've done wellness and reablement. It didn't actually take any longer, or maybe 1 minute longer, but it was still an opportunity that presented itself. And so I think we need to consider reablement interventions on a continuum of just the little things that we do every day right through to the much more intensive, your allocation of time in a designated reablement period, if that helps. And I just really hope the little bit often message came through really strongly today because it's so important, both psychologically, psychosocially, and for the sort of other outcomes for cognition and physical abilities.
Those tiny things that can make such a big difference. They can be the focus. Yeah.
As Karina was saying in the panel, some really good practical examples, I think, from her perspective on this. So, thanks.
I'd like to on as well, momentarily.
Yes, of course. Thank you, Hillary.
I mean, I also support what Lisa has said. I don't think we can afford not to do it. Like many of you, I've worked in different environments in home care, including reablement programs, working with care staff, working with clients, and sometimes it might require a little bit more time up front, and it might be 5 minutes, it might be 10 minutes, and I do appreciate that everybody's really stretched at the moment, but it actually can reduce the ongoing time and effort needed down the line. So if we think about it in that respect, so it means there are fewer longer term interventions, there's my phone going off, less sort of crisis management potentially, and more capacity in the future. Because if we are looking at having to support growing numbers of older people with increasing levels of difficulty or frailty or whatever we know, and we're working to negate that and avoid that, we want to be working with ways with people so that down the track, we're not building needing higher levels of care, because then we are going to get in trouble. So yes, there are sort of some people that you're always going to take more time, but I think a lot of people, a little bit of time cumulatively can make a big difference. And we just can't afford not to do it, just from a dignity perspective, but also from a volume perspective and capacity into the future. That's my feeling.
Yeah, I agree. So, look, thank you very much for all chipping in on that pretty fundamental question which had come up earlier in the day.